So there is a more demand for the inpatient coders, IP coding. Last year and this year also I seen there are more opportunities in that, but people are not available. Skilled people are not available. Can you tell about IP coding,
Okay,
inpatient coding?
fine. See, inpatient coders demand is always high. I've seen from 2004, not now. Since 20 years I'm saying demand is more for the IP coders because IP coders, inpatient coders, very rare. And it's a highly skilled job.
Yes, sir.
To
Skills.
become an IP coder, first of all, you should learn the OP coding, outpatient coding. According to me, if you ask me what's the best way, after outpatient coding exam,
Okay.
you practice, develop the skill, do the job. After 1 or 2 years, then go for the IP coding.
Okay.
Because
So
in the IP coding, you have to go through a lot of documentation
yes, yes.
and a lot of terminology will be there. You have to study pharmacology, pathology, anatomy, physiology, right? And a lot of guidelines will be there. And then go for the IP coding exam.
Okay.
So because of this, demand is very high because there is no skilled people.
Yes, sir. A person cannot, direct in a IPDR. At least he should have some basic knowledge
Yes.
about the diseases.
Exactly.
OP
Yes.
coding.
Yes. Yes. So that's why we say first learn OP coding, then do the work, then go for the IP coding. I said don't jump to IP coding. You can directly go for IP coding also. It's your choice. But I say first do CPC, then go for the CCS or CAC.
Okay.
First learn OP coding, job, then IP coding. That is nothing but CAC or CCS. Okay. And in the IP coding, you have to focus more on the documentation. First point.
Okay.
Second point is knowledge of pharmacology, pathology. You should know how to query physician. You have to follow AHIMA ethical standards for the querying physician. You have to know how to assign the principal diagnosis. You should know how to assign the proper IPDRG. Any IPDRG is assigned by the group or software.
Yeah.
But selecting the principal diagnosis is very important along with the CCMCC.
Yeah, sir. In various programs also, certification programs, most of the guidelines are there which condition has to reported. I mean, first in place. It's a medical necessity. So we didn't apply it in OP, but it is more important in inpatient coding.
Exactly, yes,
Yeah.
yes. So that's why in the AHIMA CCS exam, you have 5 domains. 40% to 50% is the domain 1, which talks about the coding guidelines. So to write the IP coding exam or AHIMA CCS or CSC exam, you have to go through all the guidelines, practice very well, at least practice 1500 scenarios
Okay.
from the medical coding aspect. Assign the UHDDS guidelines, Uniform Hospital Discharge Data Set.
Okay.
How to assign principal diagnosis. How to identify CCMCC condition.
Okay.
How to abstract the data from the medical record.
Okay.
You have to see the medications. You have to see the, it is called CDM. And then assign the codes properly. And many times you have to query physician. You have to ask non-leading questions. You have to give clinical indicators in the querying. And not only that, an IP coder should know how to interpret documentation and how to abstract the data from the documentation and how to query physician as per the AHIMA ethical standards, AHIMA standards.
Okay.
Okay? And a lot of people have seen the directly they quote from discharge summary. That's very totally wrong. You have to see from the admission note to discharge summary compulsory. You have to go through all documentation. See, for example, if you quote directly from discharge summary, you may miss some documentation, you may miss something in the reports, right? Or you may miss some progress notes.
Yeah, sir. I have seen different guidelines in different projects, but the logic should be matched. There are logics for every convention, every guideline.
Yes.
I heard this so many times. Code only discharge summary.
No,
If
you
there
should
is no
never
di-
quote from discharge summary. Discharge summary is an important part of the
Yes,
documentation,
it's in a summary, yeah.
but you have to go through entire documentation.
Yes, and also in some projects now, so it's not like that. We need to understand what is the concept there. Information should not be missed from the medical document. So whatever the guideline, no guideline, it can be any guideline, but it not says that you can just code from this area, you can leave that.
No,
There is no
you have to
concept.
follow guidelines.
Yes,
Compulsory. And in AHIMA CCS exam or CSC exam, you should know about PCS coding also. It's called procedural coding system
Yes.
for the inpatient. Okay, and PCS coding is pretty straightforward. You can learn within maybe 30-40 hours training is enough. But PCS coding requires a lot of practice. Because you have to select the 7 characters, appropriate 7 characters, and then assign the codes properly. So as IP coder, you should know how to code principal diagnosis, principal procedure, identify CCMCC condition, and then grouper will be automatically the DRG, the power image DRG, and based upon DRG you get the reimbursement.
So for this certification, whatever you said, all these concepts, only theoretical, sir, we have any like an incubator for this certification to practice on charts?
So to pass inpatient coding exam, only theory is not enough.
Yeah, that's
It requires a lot of discussion.
okay.
You have to discuss each and every medical record, why this principal diagnosis is correct, why this is wrong. So in IP coding, you should know how to read the documentation,
Yes, sir.
how to apply the MEAT.
Yeah, meet concepts, sir. Monitoring, evaluation, assessment, and training.
Yes.
I'll say that, sir. MEAT I will say in a short term, like it's in a care by the physician, care by
Exactly.
the provider.
Either monitoring or evaluation, or assessment or treatment.
So it's a care generally given by the doctor.
See, for example, you see a drug in the medical record for the asthma. And you have to search for the medical record where is something asthma is there or not. So if you don't know the drug, why the drug is given by the physician, and you miss the coding asthma here, right? So that's why pharmacology knowledge is also very important.
Yes,
So I'll tell them, Dr. Naresh, in my experience, I've seen the medical records more than 1,000 pages. Because you get the CDM, chart description master, you get the complete documentation, all the lab reports. So you have to go through each and every record to assign the codes. Because even if you miss one page, one condition, you mess up with the principal diagnosis. Right?
Yes, sir. Here I can add one point, sir. There are two concepts, sir. According to my career experience, I think there are payer side requirements are there, provider side requirements are there. Provider side project generally, is there any, there are different type of requirements are there, but mostly based on the meet criteria.
Exactly.
Care is any, so what is the care given?
Yes.
If care is given, you can report that condition.
Exactly.
Otherwise you can't.
Yes.
In payer side, if care is given, okay, and if there is any medication, any evidence, the condition is still present for the patient, because payers needed that information. So for that year, or by now, so what is the status of the patient? What are the condition patient has? This is the information they needed.
Exactly.
And what are the services given correctly or not? It's an quality is there.
Yes.
And also to increase the RAF score, so get the getter payments.
Correct.
So
True.
the concept is there, but not every coder understand this concept. If we
Yes.
understood this concept, now we can go with the any guideline we can understand.
That's the reason, Dr. Naresh, here for the AHIMA CCS exam, you have to study a lot.
Yeah.
Not only coding. Coding is only 40-50%. Especially if you see AHIMA CCS, you have to learn about the HIPAA compliance, high-tech law. You have to learn about the EHR, EMR. You should know about how CSE works, computer-assisted coding. You should know about how to apply the payer guidelines. NGCI, National Card Coding Initiative.
Yes, sir.
So these lot of things are there for the IP code, right? IP coding is not easy job. But if you study properly, practice properly, clear the exam, IP coding will provide very good salaries. And if you see online also, statistics shows that IP coders get more salary compared to other coders. Because it's a skilled job.
Yeah, every aspect of work, the knowledge is required for the IP training.
Yes.
Because not only procedures, not only TCS and quality measures, this type of works any person is done now, then they can do.
Exactly, yes. To clear the AHIMA CCS exam or CSE exam, an IP coder should work on these things. First of all, ICT and CM coding guidelines very important in detail. Second is PCS coding, procedural coding. Third one is how to identify the principal diagnosis.
Yeah.
You can identify principal diagnosis only if you go through documentation properly.
Yes.
How to assign principal procedure.
This is the principle. Yeah.
And how to identify CCMCC condition. DRG is given by the grouper, but if you follow these steps, then DRG grouper will provide the DRG.
Then we can assign this.
Yes.
Yeah.
Lot of times you may see some controversy in documentation. Then you have to query physician.
Yeah, sir. Querying the physician requires a lot of knowledge.
Because there's a system is there how to query physician. Yes. Even AHIMA CCS exam also, you get some questions on the AHIMA query system about how to query physician.
Yes, sir.
Because they teach you exactly how to add clinical indicators in the query to get the proper response. because you should not ask leading question. So AHIMA explains very clearly how to query physician, and HIPAA compliance, high tech law, EHR, and very important is HSC condition, hospital acquired condition. You know what are the HSC conditions, and POA, present on admission, PSI, patient safety indicators. You have to learn all these things to clear the CCS exam. Again, keep one thing in the mind: you're not studying to pass the exam. You're studying to do the job.
Yes, sir.
Once you get the IP coding job, trust me, you can use a lot of softwares, lot of tools like 3M, excellent tool. Coding becomes very easy for you. The whatever practice you do in the during the exam period or training period, once you get the tools in your hand, once you get the guidelines from the employer, IP coding is a wonderful job in the medical coding industry. Yeah. So I suggest everyone upskill to the IP coding compulsory after minimum 1 or 2 years experience.
Okay.
Yeah, but if you can directly go for IP coding if you're a doctor or a medical student. But I suggest first IP coding, first OP coding, go for the job, and then go for the inpatient coding.
Yeah. Even though not only with the certifications, and whenever we are shifting the careers in a different specialty, same coding but in a different specialty. For example, an HCC coder want to do their surgery coding, so you want to do a certification. So not only certification, I heard that there is an incubator, so where they can practice on different, so many thousands of surgery related documents are there. They can practice on that. It's like in a simulation.
Exactly. That's what. See, practice. See, it's not that you see the question, you answer the question. In the live work, you won't get 4-5 lines question. In the live work, you get a medical record more than 50-60 pages or more than 500 pages.
Yeah, sir. So
in the exam, you may have only 1 or 2 page question.
Yes.
But live work has 500 pages of medical records, and you have to answer the questions properly.
Yeah, sir.
Yep.
It's not an option.
That's the gap. To fill that gap, you have to go for the skill enhancement program after certification.
So even it is very helpful, sir. It's like, whenever we goes now, company asks that if you should be at least 1 year experience, then it will be good. But the experience they will get once they start the work.
Exactly. Yes.
So I think they can get the experience by this incubator and FIMC programs.
Yep.
Sir, healthcare system and medical coding, medical billing is called as evergreen, and there is no recession in that field.
Yes.
So what is the actual market size, sir, in a various, according to coding, and is there any statistics on that?
Yeah, actually I've done extensive research online and I found some numbers here. As per the market research future, they've done research, and as per them, medical coding market size is 40.86 billion. And I underline once again, 40.86 billion by 2032 for medical coding only. And as per the President's research, medical billing market size is 18.74 billion by 2030.
For the billing?
Billing.
Okay.
Coding is 40.86 billions and billing is 8.7 billions. And coming to AI coding, it's a very interesting fact. AI coding, do you know what's the market size? As per the Forward Healthcare research, it is 7.15 billion by 2032.
So as of now also, sir, everyone is, taking the AI support in their work.
Yes. Yeah. So I'll tell one thing. See here, as of now, demand is very high. Okay. You can see the medical coding markets as billing and AI coding, right? That's why I tell every medical coder should learn billing compulsory and also AI compulsory. Because future is going to be AI. AI is not going to replace you. You have to embrace, it's going to help you to do the work properly. You have to embrace the AI. Okay. So to fill that gap, at medicine, we provide medical billing training with CPMB certification, that's called Certified Professional Medical Biller. And also we provide training called CIMC AI Medical Coder.
So along with the usual certification program, this is also
it's a bonus for them, yes. Because see the market says, right? So definitely you have to have 360 degrees knowledge and skill to get a wonderful career. As I said, recession-proof career. So if you don't learn, you'll stay behind. So that's why to get a wonderful career, you have to learn coding, medical billing, and also AI also.
So that is a problem, sir, in market. Everyone learns one certification, one job, and they don't try new things. They don't learn different.
Once they come to comfort zone, they won't learn. But even again, if you want to learn also, you have to spend a lot of money. Again, if
Yeah,
you
that
want
is
to learn
also
the new specialty, you have to spend lots of rupees, right? You have to buy the books, you have to get study guides, you have to buy sample papers and mock exams, and you have to buy the examination voucher. All those things will be there, right? So to fill that gap only, we have the fellowship programs
Okay.
without any financial burden.